Hello, welcome to Queen Margaret University's Open Day and welcome to the Master of Nursing in Adult Nursing 2020. The programme lead is Ruth McGowan, Senior Lecturer in Nursing, and her email address is rmcgowan@qmu.ac.uk. Our philosophy is guided by McCormick and McCantz's definition of person-centeredness, and they define person-centeredness as an approach to practice established through the formation and fostering of healthful relationships between all care providers, service users, and others significant to them in their lives. It is underpinned by values of respect for persons, individual right to self-determination, and mutual respect and understanding. And it is enabled by cultures of empowerment that foster continuous approaches to practice development and quality enhancement. By the end of our programme, we believe that all our nurses will become change makers who navigate their way around complex situations. They will be leaders of the future who are creative and willing to take risks. They will be courageous, reflective, and they will advocate for all those in their care. Our nursing programme, along with all the nursing programmes in the UK, were revalidated this year and will adhere to the new guidelines, which are on the right hand side, platforms 1 to platform 7. And we've mapped these platforms on to the person-centred practice framework, which is the diagram on the left, and was developed by McCormick and McCants in 2015, and on which our nursing philosophy rests. So this is the newly validated programme, and it is a 4-year programme, and it will lead to a Masters of Nursing qualification. There is also, though, an option to take a Bachelor of Sciences Honours route from the end of Year 2, and this would lead to an honours degree qualification in the same time frame, in the same 4 years. And both routes result in the student being able to register with the Nursing and Midwifery Council as an adult nurse. Students will actively engage in creative and critical ways of learning, and this learning includes approaches such as critical inquiry, reflection, contemplation, simulation, and practice learning experiences. And throughout the 4 years, our programme encompasses these 5 strands: nursing paradigms, prerequisites for person-centred practice, person-centred processes in nursing, active learning communities, and then exploring care environments and developing and facilitating leadership within teams and cultures. And throughout each of the 4 years, the complexity of the student learning experience increases. Entry requirements into this programme: with the Scottish Higher, we would look for 4 Bs, but we would accept a minimum of 3 Bs and a C. With A levels, we look for 1 B and 2 Cs. The Irish Leaving Certificate is H2, H2, H3 and H3. International Baccalaureate, we look for 30 points. And we also have a variety of access and swap routes. And for international students, we look for an IELTS score of 7.0 and with no element lower than 7.0. Students can become direct entrants into Year 2 if they have the required number of placement hours. So we have requirement subjects. We look for discursive subjects, and these could be English, history, modern studies, philosophy, sociology or psychology. We also look for science subjects, which could be human biology or biology, chemistry or physics. And all combinations of qualifications must include a science or science-based subject and one of the discursive subjects. Maths and English are required at National 5 level at a B grade. Teaching and learning, we use a wide range of learning and teaching methods to make sure that your learning experience is as good as possible. These include face-to-face and online lectures, facilitated online study groups, skills sessions, simulation, group work, role play, self-directed study, active learning communities, and portfolios. So you can see there's lots of different ways of learning within the university. This is a photograph of our clinical simulation suite with one of our patients, pretend patients. Practice learning experience, of course, is essential within our program, and students can be placed in Lothian, Borders, Fife, and occasionally Forth Valley. And your placement will comprise a combination of hospital, community care home, and voluntary sector. During your placement weeks, you will have a mentor in practice, and you'll also have one of the nursing team here at the university as a supervisor while you're in practice. There is SAS support for travel or accommodation. You'll need to apply for that, and all our placements are audited. That means that they're checked for quality, and they are shared with the University of Edinburgh and Edinburgh Napier University. There's a range of student supports available in the university, from our program leader, Ruth McGowan, from the year managers, cohort managers within the program, from the lecturer who is in charge of each module, from the clinical supervisors, from each student's personal academic tutor. When it comes to fourth year, all students will be allocated a dissertation supervisor. And then throughout the university, there's the staff student consultative committee, there's the effective learning service within the library, there's the student union and the student parliament. Now, of course, there is assessment throughout the program, but there are a variety of assessment methods used, from exams which may be seen or unseen, online assessments, written assignments or visual assignments, group work, practice placement portfolio for clinical placement, and OSCEs, which are the practical assessment of your skills. All students must have a satisfactory Disclosure Scotland check. All students are offered vaccination against hepatitis B virus. Students need to declare themselves to be of good character and in good health, and this is an NMC regulation. And students with additional educational needs will be supported by the Student Services team and the teaching team. These are some of our happy students after 4 years at Queen Margaret University, ready to embark on a world of registered nursing. And these are also some of our students on their graduation day at Edinburgh. So thank you very much for listening, and I do hope you found that interesting. If you have any questions, please just send an email to Ruth McGowan and she will happily answer it for you.